A strong warning tonight to go out and get yourself vaccinated for whooping cough. There have been 12,000 cases of pertussis reported in Arizona. It is highly contagious, especially amongst school children. The cough can last 100 days, and in some cases, it can be deadly. Joining us now is Dwayne Wooten with Rainbow Pediatrics to discuss the recent outbreak here in Arizona. And first of all, thank you for being with us on a Saturday evening. You know, I have not heard of whooping cough being, first of all, not only contagious, but having an issue with an outbreak. Is this rare? It's
not rare at all. In fact, whooping cough is one of the most contagious diseases that we immunize against in the country. And yes, it does cause fatalities sometimes. And that's why we pediatricians are really zealous about the use of vaccines to prevent whooping cough, as well as the other communicable diseases. But whooping cough is, as you can see by the screen, the video you show, can be devastating to smaller children.
Okay, so now you're talking about being devastating to smaller children. So do you recommend that only children get vaccinated, or what about adults?
Well, the adults want to make sure that they're fully immunized, and if they're not, they can get the pertussis vaccine later in life, but usually it's taken care of by the early vaccination series. You know, we give it at 2, 4, and 6 months of age. The ones that are most vulnerable are the smaller children. The smaller you are, the more contagious you are, and the more deadly it can be. And yes, in my practice, I've actually had to pronounce a kid dead from whooping cough.
Wow.
And it's very frightening. It's one of the things that I remember most in my almost 30-year career, is having to wait for that final heartbeat. And a kid who actually died from something that was totally preventable. So parents have to get their small children immunized.
Now, I have a child who has asthma, so she coughs a lot. How do you know the difference between a regular cough and whooping cough?
A whooping cough, or pertussis, is an extremely significant cough. I mean, it's a cough, we call it whooping cough because it's a cough so bad that in between breaths they have to take a deep breath, and it's a whooping sound because it's such a difficult, long-standing cough. These kids will cough continuously until they have to take a pause and breath and continue on to cough. And sometimes we actually have to paralyze children who have whooping cough to get them to able to be saturated. In other words, keep oxygen saturation up. It's that bad at times.
So, you know, it's now flu season, or we're coming upon flu season, and so you're taking your kids and yourself to the doctor. So would you say when you go to the doctor that you should say, not only do I need a shot for the flu, a flu shot vaccination, but I also need one for whooping cough?
If the children get their routine immunizations, they're going to get that pertussis, DPT, the P is pertussis. So they're getting it already. The question, the problem becomes when parents say, I'm not going to vaccinate my children. And then you have a whole cascade of events that happen after that. You have children who are being exposed, children in the doctor's offices, for instance, when a person comes in for just an ear infection or earache, they can actually expose a 2, 3, 4-month-old child with pertussis because they weren't vaccinated. So lots of doctors refuse to even allow unvaccinated children in their offices at this time of year in particular.
All right, Dr. Wooten, thank you so much for being here.
My pleasure.
Great information.